Hi all, this is Dr. Kamlam Iyer, child and adolescent neuropsychologist from Manipal Hospitals, Varthur. Today, I present to you the topic of discussing and holding conversations about emotions in children and adolescents. Children also experience a wide array of emotions just like we adults. Though I do not consider any particular emotion as bad or negative per se, we could generally classify them as positive and negative in order to facilitate the change mechanisms. A list of positive emotions in children could be joy, happiness, excitement, and thrill. Conversely, a list of negative emotions in children could range from sadness, anger, loneliness, and grief. It is important for the parents and the caregivers to teach children and adolescents the difference between feeling, thought, and behavior vis-a-vis a particular emotional experience. So, how does the parent or the caregiver go about doing so? Firstly, help the child identify the appropriate emotion to the particular circumstance. For very young children, one could use the charts of emotions using an emoji reactions and finding out which emotion comes close to what they are feeling. Secondly, help them name the emotion appropriately. Use a theme or a story in order to facilitate the child to talk about the context or the situation where the particular emotion is experienced by the child. Next, listen intently and agree on the truth of their emotion from the child's position and perspective. Do not argue about the emotion that they are in. Lastly, you could help them cultivate the positive emotions by asking them to focus from within to outside. That is, assist them in openly talking and ventilating their emotions to somebody very close and confident to them. Also, the parent could use humor to handle the difficult situation with the child without mocking the child's emotion or the situation that the child finds herself or himself into. Lastly, explain how all the emotions are needed for all of us, but we could choose the emotions wisely to help us navigate it across the situation. All these steps would help the children understand their emotions rather than withdrawing from them, denying them, or still worse, not talking about what is happening within them. It is imperative to teach children and adolescents the expression and the sharing of emotions to the right people at the right setting, in the right situation, and at the right amount. For further assistance and encouragement, please contact us at Manipal Hospitals, Varthur. Thank you.